Hello, 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 my friends. Hello there. It's Jill Osborne from the Interstitial Cystitis Network. It is Sunday, February 20th, and it is time for a drop-in IC support group meeting. Now, I changed the title because we're actually doing IC support. We're doing Hunner's lesion support. We're doing COVID cystitis support. We do chemo cystitis support. We do ketamine cystitis report, radiation cystitis support, eosinophilic cystitis support. So basically, if you're having a bladder issue and it's not a UTI and it looks like it's an unusual and kind of rarer form of cystitis, I'm your girl. So my purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody to minimize you, to demean you, to insult you, to suggest that it is all in your head, because it is absolutely not all in your head. Hello, Deborah. Nice to see you. We are simulcasting right now on Facebook and YouTube. If I'm looking here, I'm looking at Facebook. If I'm looking here, I'm looking at YouTube. And lots of technical challenges this morning. My streaming computer did not want to start up. So if I suddenly go black and it goes dead, then we can assume that the computer has crashed. I'm going to have to get another computer, apparently. Jennifer, thank you for the 200 stars. I really appreciate that. All righty here. Let me get myself together. Whoops. So my hair is all weird today. Sorry about that. It is what it is. It is what it is. Come on. What is this on my glasses? There's something on my glasses too. It's one of those days. Is that better? Nope. These are my favorite glasses. Is that better? What is that? It better not be a scratch. No. Okay. Hello, Mary. Nice to see you. Hello, Karen. Hi, Jennifer. Hi, Jeannie. All righty here. So, so let me just introduce myself here, and Sandra, I will come to your question very, very quickly. Actually, let me answer your question now. Does IC go to your kidneys? No, we don't have any data that suggests that IC progresses to your kidneys, because what the hell is IC, right? We remember we have subtypes now. Not everybody has an incurable bladder disease. There's no evidence that IC is linked to a kidney issue at all. You say you can't feel your bladder anymore from surgeries, but you feel it all in your kidneys. I can't really understand the anatomy of that. You're assuming that something with your bladder went upwards through your kidneys, or something from your kidneys went downwards through your bladder. There's something called reflux, ureteral reflux, where urine goes backwards. Instead of going down, it goes up, and it gets up to the kidneys and causes issues with the kidneys. So what does your urologist say about that? Hi, Boria. Hello, Kaylin. Kaylin says, I'm finally doing what I would do. Well, hello, Mary. Hi, Becky. Hi, Jennifer. Does IC cause hip pain? No, but pelvic floor dysfunction can cause hip pain. Sandra says, when I have to pee, I feel it in my kidneys now rather than not my bladder. I don't understand that at all. Mary says she's not getting anything audio or pictures. Mary, everybody else on Facebook, you can hear me, right? Can you see me and you can hear me? Hi, Gay on YouTube. Mary says, does Baclofen help bladder spasms? No, Baclofen is a smooth muscle. Well, no, Baclofen is a skeletal muscle relaxant. Your bladder does not have skeletal muscle. It has smooth muscle. It's a different type of muscle. So Baclofen is for pelvic floor spasms. If you're having true bladder spasms, you have to use a smooth muscle relaxant. That's going to be ditropan detrol or mirabegron. Come on, what is this with my glasses here? What is going on here? Do I have my little glass cleaning spray? Yeah, I do. Here it is. Hold on. So let me just take a moment and introduce myself. Normally I'm a little a little more put together than I am this morning. It's just because I had to help my folks a little bit. So my name is Jill Osborne. I'm the National IC Support Group Leader. I'm the longest serving support group leader in the United States. And I'm pretty much tied now, I think, with Germany. I started my support group in September of 1993. They started their group in 1993 in terms of having active support group meetings. I bring to you 3 college degrees. I have a degree in chemistry, a degree in drug development, a master's degree in psychology, and all that sort of good stuff. I served on the U.S. Army IC research panel for about 10 years, allocating millions of dollars to IC research with a panel of other IC experts and researchers. I do research also, the IC Network, which is the largest archive of IC information on the web. Our website, icnetwork.org or ic-network.com. We do quite a bit of research through the IC network. We've done quite a bit of pentosin, pigmentary maculopathy, you name it, we've done it. I mean, we've been doing this for 28 years now. So, hopefully I can bring to you a set of skills and a set of knowledge that my goal here is to try to open some new doors of treatment for you. I want to educate you, empower you, and then my job is to kick you back to your doctor and with better questions, with more informed questions, right? Normally when I do these meetings, I do about a 30-minute little riff on something, and then I will take your questions. And sometimes we go to Zoom, sometimes we don't go to Zoom. It depends. Deborah says here on YouTube, my bladder will feel like there's some kind of vibration. So Deborah, that vibration sensation is really important. And so that it can be 3 things. It can be your bladder wall fluttering, remember, the only voice your bladder has to tell you that there's a problem is with frequency, urgency, pressure, pain, right? Those are the nerves that your bladder has to communicate with you to tell you that there's a problem, whether it is interstitial cystitis, a Hunner's lesion, infection, cancer, whatever. All the symptoms are the same. But sometimes the bladder can quiver and it can feel like a little fluttering. It might be a little bladder spasm. So that's one potential source of vibration. But the second thing we really want to look at maybe is pudendal neuralgia. Are your muscles so tight they're squeezing a nerve, and now that nerve is starting to flutter? Is that a possibility? Because that happens to me. I think I first noticed it like 15 years ago when I was sitting on a Saturday. It was a Saturday. And I was sitting here in front of my computer doing a whole bunch of IC stuff. And then I went and sat somewhere else. And I literally didn't get up for like 12 hours. I was just sitting. I was powering through whatever I was working on. And I started feeling this a fluttering in my left butt cheek. And it was about 1 inch to the left or 1.5 inches to the left of my rectum. It was definitely in the left side. And that was actually a muscle squeezing a nerve. I once worked with a gentleman who called me, who said, Jill, whenever I sit down, I vibrate so badly, it could literally throw me off the chair. And we knew exactly what that was. That was, again, a pudendal nerve entrapment compromised also by tight muscles. So you definitely, something's going on there. I will tell you that if I sit too long, it comes right back. And so it's something that I've got to pay attention to. As I sit here right now, I can feel it a little bit. I mean, I've had it for like 15 years and it gets worse the longer I sit. Also, if I'm crossing my right leg over my left and I'm pushing my leg down, that will make it worse. Marcia says she notices her vaginal area fluttering occasionally. What could this be? Pelvic floor spasm, most likely. Alexia says you can use Valium and insert down there. If the insurance doesn't pay for the suppository, your urologist can substitute for the pill form, right? So that's a good suggestion. A vaginal Valium suppository will deliver a muscle relaxant directly into those tissues. Kayleen says I get a buzzing feeling when I was told that was nerves related to the vulvodynia. Exactly. It's related to nerves. It's related to nerves. I get exactly the same thing. Doesn't hurt. I have to say, it really, honestly, I've never really had pain and discomfort with the fluttering. It's just there. And the longer I sit, the worse it gets. And finally, I've got to get up. And that's the key with pudendal neuralgia, is you're supposed to avoid those things, which makes it worse, right? So if sitting makes it worse, you've got to stand up, move around. And that's something that I really work on. I really, really, really try to make sure that I'm moving around a lot during the day. For those of you who call me and we're talking on the phone, most of you already know I'm always up and walking. I've got my headset up and I'm literally walking. All right, let's see here. Katie says, my generic tests show nightshade intolerance, which can cause inflammation. Could my bladder symptoms be due to nightshade? Maybe. Possible. You won't know until you try it. So eliminate those foods and let's see what happens. Georgia said, I heard now there's a new treatment. So that's what I wanted to talk about today. So, you know, I worked all day yesterday because I really realized that I hadn't put much new content up on our website. I've been working so hard on our magazine and other things that I hadn't put up any new blogs. And so I put up 4 new blogs yesterday. And one of the blogs was an update on platelet-rich plasma. So literally for maybe the last, I'm going to say 5 years or so, we've had kind of utterings at the research level that something called platelet-rich plasma appears to be effective for reducing some of the irritation in the bladder wall and or maybe even helping the structural integrity of the bladder wall. So what is platelet-rich plasma? Basically what it is, it's your own blood. What they do is they take a sample of your blood and then they put it in a centrifuge and then they isolate the plasma and growth factors. And so you actually end up, your blood is normally red, right? Or dark red. But when they spin it, you end up with this yellow solution that is actually plasma. And so platelet-rich plasma has been used for a number of years to kind of enhance wound healing, to treat a number of other conditions. And most of the research is coming out of Asia, but it's very, very consistent. And so last fall and this January, last month, we had 2 new studies. And the first study was from Italy. And so, and I don't have the exact details. What they did, I know I don't have the details, because what they did instead was they did a literature review. So they went through all of the other published studies on platelet-rich plasma and then created their own paper, which is what happens. We don't have the time to research every paper. So if other doctors can kind of do that and sum it up for everybody, that's a good thing, right? And so researchers in Italy reviewed the efficacy of intravesical platelet-rich plasma injections. That means they injected it directly into the bladder in subjects with IC. The treatment appears to show less bleeding, fewer inflammatory cytokines, and an increase in the healthy division of urothelial cells. What does that mean? That means growth and healing. In 3 clinical trials reviewed, patients who underwent monthly PRP injections were found to have a statistically significant improvement in symptoms with the modulation of growth factors and inflammatory proteins. So they believe that it could help trigger/enhance what we call tissue regeneration or healing. It's all about healing. So that was published in a European journal called Antibiotics Basal. I personally haven't read that journal. But here's the other one. So this was just published last month. This is a study from China, which sought to determine if platelet-rich plasma improved the structural integrity of the bladder wall, specifically urothelial cell growth, the cytoskeleton, inflammation, and barrier function protein expressions in patients with IC. So 19 patients underwent 4 monthly intravesical PRP injections. Bladder biopsies were taken at the first and the 4th treatment. After the injections, a functional bladder capacity and maximum flow rate increased, and pain, other symptoms improved. It improved in every single patient. The level of urothelial barrier function protein and cell proliferation in the patients with IC was increased after repeat injections. Intravesical PRP injections may have the potential to improve urothelial health and result in symptom improvement in patients with IC. So anyway, this is, a lot of you always ask, where's the research? What are they doing? Well, there you go, hon. There you go. That's an extremely promising line of research that because they're using your own tissue, the odds of you having side effects or an allergic reaction to the therapy is greatly, greatly diminished. Now, the challenge with research like this is it's very hard to get funded. Why? Because there's no profit in it. It's not something they're going to be able to patent like a medication. And so you would have a pharmaceutical company investing millions of dollars to try to get this approved by the FDA. This is exactly the same thing we saw in some of the early stem cell research. And that is that because there's no profit in it, you're not going to have big company involvement. Thus, getting the research funded is really difficult. But it is extremely promising. So when I posted this on Facebook, the immediate question is, who in the U.S. is doing this, and can we do this? And here's the challenge. There are no current clinical trials going on with platelet-rich plasma and interstitial cystitis. I do believe that they are under development. I do believe that one of the top IC research centers is going to jump onto this bandwagon fairly quickly because this is extremely promising. So I will keep you posted. I've already put my feelers out. I'm already in contact with some of the top IC doctors. So we're just going to see if we can find if anybody is doing this right now. But that's extremely promising. Something else that was interesting, some doctors who work with women with frequency urgency and or quote unquote IC actually will suggest a variety of medications typically used for men, like Cialis. And of course, these medications are not listed in the AUA guidelines for interstitial cystitis in any way, shape, form. Yeah, I can still remember I was working with one patient in Sweden who's kept saying that Flomax, which is often used for benign prostate hyperplasia and trying to improve your urination, if I got that correctly, that it really helped her. I was like, I don't understand why or how that would help you, but power to you. Well, now we have a research study from Portugal, which has shown that Cialis appears to help interstitial cystitis by decreasing bladder nerve hyperactivity, by relaxing the smooth muscle of the bladder, and by improving microcirculation in the bladder wall. So this was a smaller study. They gave a daily dose of 5 milligrams in patients, IC patients unresponsive to any other therapy. A total of 14 patients were treated for 3 months. And let's see. And now what was interesting is there's absolutely no difference in patients with Hunner's lesions versus patients without Hunner's lesions. 2 dropped out due to unsatisfactory results, 2 due to persistent headache and or tachycardia, which were discontinued after stopping the drug. However, they concluded that it was an easy, well-tolerated, effective treatment. I do want to take a moment and express my condolences to the family of Dr. James Malone Lee. Dr. James Malone Lee is extremely famous urologist in England who was very aggressive in pursuing chronic UTI, recurring UTI. There is no doubt that his contribution to urology and to the pelvic pain community and to the bladder infection community is undeniable and unprecedented. His patients are grieving terribly. His colleagues are sharing fabulous stories. It is very, very clear that he was a wonderful teacher of other young doctors, that he was a very kind, compassionate, and caring man. And so for those of you who have followed Dr. James Maloney, he did pass away of cancer yesterday morning. And he had communicated a week, 10 days earlier on his Twitter account that he was told that he had an unsurvivable cancer. And so he passed very quickly and very peacefully. And so if you could please say a prayer for Dr. James Maloney and his family, that would be wonderful, as well as to all of his patients, because clearly they adored him. Let's see, what else do we have? Another interesting study from the United Kingdom asking, do IC patients have effectiveness from oral medications? 173 patients completed the survey. You know, that's a pretty small survey. And basically, what that study shows is that the current traditional therapies were not that effective, and patients looked outside those to other things like supplements. Oh, okay. And here's one more really good one, and that is Botox, botulinum toxin, right? So Botox. What does Botox do? Well, I should have had Botox in my face, right? When you have a Botox injection, it silences the nerve. Obviously, I did not do that, which is why my face is changing as I'm getting older. Anyway, so Botox has been used for a number of medical conditions. It's certainly been used in the bladder for many, many years. The challenge with Botox is if you inject it into the bladder wall, you run the risk of actually silencing the nerve that allows you to pee. So Botox is never supposed to be used in patients who are unable to self-catheterize, because that is a real documented risk. Urinary retention is a risk of Botox therapy. And so, you know, another group of researchers said, well, can we just do Botox as a bladder installation? Can't we just, you know, put it in a liquid and just instill it into the bladder? Would it have the same effectiveness? And researchers in China looked over all the research studies, and what they found is that the Botox injections into the bladder wall were more effective than the intravesical installations, but the installation had far fewer side effects. It didn't cause urinary retention or UTI. So that was cool. Another interesting study is, you know, always looking for ways of trying to diagnose the health of the bladder. You know, because remember, for some of us, it's not the bladder. For some of us, it's our pelvic floor, endometriosis, or fibroid tumors, or Tarlov cysts, or pelvic congestion syndrome, right? So there's always, we don't think of IC as a bladder disease anymore. We think of it as a pelvic pain syndrome. But one of the ways that we can identify to see if a bladder is really, really sick and diseased or injured is by its thickness. Because a normal bladder that is not injured is thin and soft and pliant, and it stretches easily to fill up with urine, and then it drains easily. It drains easily, which is very, very interesting. But as that bladder wall is injured or traumatized, it gets thicker, and as it gets thicker, it cannot stretch as much. So we have researchers here who found that if you measured the bladder wall with a CAT scan, that would help us identify those patients who had clear bladder disease versus patients who didn't have clear bladder disease. And so they did CAT scans on 100 patients, 49. Now, this is important. 49 of those patients diagnosed with IC had a completely normal bladder wall. There was no clear sign of bladder wall thickening or disease. 36 had thickening in a small area, and only 15 had widespread bladder thickening. That's really important here. It's really important here. That helps us understand and it proves our case that not everybody has bladder disease. And in fact, in this study, 49 out of 100 patients had completely normal bladder thickness. So anyway, that data was very, very positive and confirming. I think that this would be a great way to actually kind of narrow down on that diagnosis. Okay, now I have a video I want to show you. Hold on one sec. I got to go get my iPad. I have a really cool video I want to show you. Hold on. Okay. I prepare to be blown away. This is the coolest video ever. And here, hold on a sec. All right. So let me get there real quick. Okay, hold on. Where is it? And go here, go here. I don't know about you guys, but like seriously, I'm like living. My iPad is on me most of the day, and I don't like that. I don't know how to break that cycle. I feel like I'm connected to electronics all the time. Okay. Okay. Here, this is a guess. I want you to look at this. What do you think that is? Any guesses? And of course, you can actually probably read the words. So you can see that something is being expressed into the bladder. You know what that is? That's urine coming from your kidneys. And so you can see that as urine comes down your ureters and enters your bladder, that's how it gets pushed out. Isn't that cool? I had never seen that before. And you can even see that on, gosh, somebody else shared a picture that was really cool. Oh, somebody says that's what a baby sneeze in utero looks like. Okay, so look at this. So here's a CAT scan. This is a CAT scan of the bladder. Let me see if I can, I want to try to hold it. You see that right there? Look, you can see the two sprays of urine going into the bladder wall right there. Isn't that neat? It's really cool. That's pretty cool. All right. So anyway, what I was just reading to you were research studies that I've summarized for our next winter, our winter IC Optus magazine, which I just got back from the typesetter, which I've got to proof tonight, and then it will go to the printer. So we will have a big new IC Optimus magazine, hopefully the next Sunday. We'll see. Mary says, my urogynecologist prescribed it for me. I assumed it was from a bladder, but apparently it relaxes my pelvic floor. She did not explain. Yeah, Baclofen. Yeah, Baclofen is for pelvic floor skeletal muscle relaxation. All right. Now, you guys, please understand with Facebook, it blocks me from scrolling back. Hold on. Let me see if I can break this out. Move tab to new window. Marcia says, can I comment on stem cell injections for IC? Some doctors at Jefferson Hospital in Philadelphia have mentioned their doctor offered it to them. Well, stem cell therapy has been explored for about 10 years or so, a variety of different types of stem cells. Usually they're fat-derived stem cells. Basically what happens is you do a liposuction, they grab a bunch of your fat, then they process it, and you end up with something called stromal vascular faction, which is a combination of stem cells and growth factors, which they then inject back into you to improve healing. We had a doctor at the California Stem Cell Therapy who was studying it intensely, and I haven't talked to him, quite honestly, in years. The last time I talked to him, he said that the response was not durable. What that means in medical terms is that the response was not long-term, that it was short-term effectiveness. And the challenge with stem cell therapy, especially in those early days of stem cell therapy, is it was patient funded. There was no pharmaceutical company underlying it. And so patients had to pay a bunch, like $5,000 or $10,000 to try to have it done. So we don't put a lot into stem cell therapy right now. Shirley says, it appears IC is attacking my appendix, so I'm on antibiotics. No, honey, that's absolutely impossible. IC cannot attack. Your bladder cannot attack your appendix. There's no way. So you either have massive inflammation happening that could be spreading throughout your body, or, remember your appendix is off of your bowel. It's at the very upper end of your large colon. So sometimes it gets infected, sometimes it can get seeds in it that can become infected, but there's no biological pathway that would allow a bladder disease to attack the appendix. The bladder issues are confined to the urinary tract. The appendix is in your your bowel. So I think instead, now if you had COVID, for example, then we certainly know that COVID-induced inflammation can affect the bladder and it can affect the bowel. We had a case study published 2 weeks ago of an 11-year-old who had COVID, who after the fact, 6 months afterwards, developed increasing bowel issues. They did all the easy stuff. And in the end, they had to do a colonoscopy. They did a biopsy. They found that her bowel was bright red, massively inflamed, and they found the COVID virus living happily in her bowel cells, the bowel tissue. So, but there's just no mechanism. There's no pathway. I mean, if you had endometriosis that was attaching to your bladder, it could certainly go up and attach to your bowel. Peter says, you can barely hear me. You guys on Facebook, how's the sound? How is the sound? Tell me. Because I'm streaming and I set up the sound correctly. So are you guys okay with sound? Alexis says, I used to use estrogen. It didn't help me. Some it might. Alexis, now listen, hon. You have to have a reality check about what estrogen is doing. Estrogen is improving the quality and health of your skin. It's not going to change your IC symptoms right away. And the problem with you stopping it is that your skin is just going to get progressively worse and worse and worse. So a lot of IC patients make the mistake of stopping estrogen because they think it's not helping them, when in fact it is helping them over time improve their skin health. Alexis says Elmeron causes liver failure. Not often, hun. Elmeron is most known for eye disease and changes in liver enzyme levels, but that's in a very small population of patients. Far more patients with Elmeron appear to be struggling with the eye issues, but that's a guess. Chelsea said I had bladder Botox on Friday. I already self-catheterized, so that wasn't a big risk for me. I'm still waiting. Excellent. Alexis says pregnancy is the only remission. It can be for about half of the patients who get pregnant. Anne says, how do you know if you need to use estrace? If your skin is dry. Kimberly says, my urologist gave me estrogen cream to use for relief. Good. Use it. Your bladder, listen, your bladder is a mucous membrane organ. Your urethra is a mucous membrane organ. It needs that nice, thick, moist mucus to protect itself. And unfortunately, as we get older and we start losing our estrogen, that mucosal barrier thins. So the The entire point of using topical estrogen is to help your skin be healthy and strong. And if you don't use it, your skin is going to get drier and drier and drier and more painful. Listen, I have worked with some ladies in their 80s whose little vulvas, what's left, because a lot of them get reabsorbed, their skin is like dry potato chips and they're in agony, absolute agony. Deborah, thank you for the 500 stars. Much, 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 much appreciated. Shirley says, inflammation from diverticulitis? Absolutely. That makes a lot more sense, hon, because that's in the bowel. Katie says, could high B12 levels in blood tests be related to IC? I'm not taking any supplements, have B vitamins. You know, actually, there's a theory that has been studied and continues to be studied, is that some patients might have a B12 processing disorder, which means they have low levels of B12. I'm not aware of any research that talks about high levels of B12. All right, so everybody else is saying the sound is good. Whew. So whoever that was who was having problems with the sound, check your volume settings, because everybody else can hear me. Alexis says, perfect here in the USA, Tennessee, the great state of Tennessee. Peter says the sound did not too well. Peter says, how about almond milk, pre-leaf, and slippery elm? Do any of these work? Almond milk is actually high in oxalates. You know, when almond milk became very, very popular, one of the things that started happening is people started getting more kidney stones that are based on oxalates, because that oxalate has to go somewhere. You got to remember that your body is designed for life in nature 5,000 years ago. And a lot of today's foods contain high quantities of things that perhaps your body was never designed to process. And so normally when we would eat almonds, we would eat a handful of almonds. We wouldn't eat, you know, a pound of almonds, right? That's just not the way the body is designed, unless your ancestors lived in an area where almonds were completely natural and found. I'm from Norway. They certainly weren't from there. Oh, go Norway Olympics. Yeah, we kicked it this year. I'm a Norwegian American. So anyway, I've worked with a number of patients over time who started doing a lot of almond milk, and they started throwing kidney stones. So I would back off on the almond milk. Pre-leaf certainly has the potential of helping not your bladder heal, but what pre-leaf is going to do is it's going to reduce acid in your urine. So if you have to eat something that is potentially triggering, you know, like going and having spaghetti, pasta somewhere, tomato-based pasta or pizza, or coffee or whatever, you can take a couple of pre-leafs before that, and that will reduce some of the residual acids in your urine. But again, it's not considered healing to the bladder wall. It's just protecting the bladder wall. Slippery elm is not something that, I mean, it might be an herb that might be a little bit soothing, kind of like with marshmallow root, but marshmallow root bothers about half the people who try it. So the rule here is to do no harm. I don't believe in taking a lot of anything here. I believe you have to do your research, talk to your doctor, et cetera, et cetera. The only thing of your list here, Peter, that I think is meaningful really is pre-leaf. If you feel good with a little slippery elm tea before you go to bed, power to you. Amy said, is there any way to get the Microgen test more affordable? No, not that I know of. You can call the company and tell them your situation, and you never know. You never know. You can write a letter to the CEO of the company and say, hey, I really need this, but I can't afford it. You know, I have to say that it's possible. Denise says, estrogen helped me enormously. And Jill, you're right. My urologist said this, you have to take it for the rest of your life. I'm 69 and had my ovaries removed 5 years ago. Yeah. Sandy said, what about IC with the subtype central sensitization? I'm always in extreme pain and I don't know what to do. So Sandy, whenever somebody says extreme pain, the very first thing that comes to mind is Hunner's lesions. Is there any chance that you have Hunner's lesions in your bladder? Because Hunner's lesions are agony. Patients with Hunner's lesions are the ones who have the most severe pain. They're down to eating 4 to 5 foods a day. Their quality of life is absolutely terrible. Sometimes they're homebound. And so if you have Hunner's lesions, the most important thing is to treat the freaking lesion, because when you treat the lesion, the pain dramatically improves and in some patients completely goes away. And so a lesion is a big wound in your bladder. Lesions are considered a unique patient group. We now call that Hunner's lesions disease. And everybody around the world, all the researchers absolutely agree that Hunner's lesions are their own distinct patient group who deserve their own distinct research and their own distinct diagnostic criteria. And I think we're going to see that as time goes on. Let me see if I have, what did I do with my thing here? By the way, I got to say, I had a flare the other night. You know, like my bladder is so freaking controlled. It is really rare that I get up more than once a night. And I had the weirdest flare the other night, and then I realized it was my pelvic floor. And when I woke up that morning, I was going, yep, that pelvic floor is tight. And I did not get out and use my wand like I should have. And that night, bam, Jill was peeing every 90 minutes all night long until I got out and worked on relaxing those muscles again. All right, so let's go right back to a Hunner's lesion. So here are pictures of Hunner's lesions. So Hunner's lesions are characterized by having what we call a stellate appearance. So they tend to have a center, an identifiable center with red arms that radiate out. Like this is a really good picture right here of a Hunner's lesion. Whoops. Here's a really good picture of a Hunner's lesion. So when you biopsy a lesion and you look at that under a microscope and you do whatever testing they normally do as they study tissue, what they consistently find is biological warfare. There's massive inflammation happening in these red areas. It's a war happening in the bladder wall, that inflammatory process. And but when you biopsy somebody who has glomerations, petechial hemorrhages, there's no inflammation. So the biggest inflammation is really just found in the patients with Hunner's lesions, and of course now with COVID cystitis and maybe chemocystitis, right? So we now have a better idea as to what could be driving some of this, because some research has found viral infection in the urine of patients with Hunner's lesions. And so that would explain, number one, why Hunner's lesions are so resistant to treatment in some people. But number two, why there is such a massive inflammatory response. And again, that is supported by, I'm working last night, I was working on our new COVID cystitis website, and I was going through the research, and again, we just see this massive inflammatory response happening in COVID wherever the virus is. And so that helps us support that maybe there's another virus like the polyoma virus or the polyoma BK or JC virus or the Epstein-Barr virus playing a role in Hunner's lesions. So that's concept number one, is do you have Hunner's lesions? And then really, so the second thing, whenever somebody works with me and they tell me that they have pain, I dived into a lot of really big questions. Okay, number one, where is the pain located? Is it inside of your body or is it on the outside of your body? Is it on your skin? Is it on your vulva, by your rectum, in your vagina? Or is it, well, anything on the outside, right? Or is it inside? Is it in your urethra? Is it in your bladder? Is it in your testicles? Is it in your penis? Is it at the tip of your penis? Is it in your vagina? Location really, really, really matters. And then we want to talk about the quality of the pain. Is it sharp or dull? What makes it better? Heat or ice? What makes it worse? Does it change throughout the day? Do you have no pain in the middle of the night? But when you wake up in the morning, as soon as you sit on the side of your bed, that's when your pain starts and your pain progresses all day. That's important because that tells us that it's probably positional and that it might be pudendal neuralgia. So if you're sleeping well at night, but your pain's terrible during the day when you're sitting, pudendal neuralgia. If you feel a pressure sensation, if you feel a pulling sensation, a pushing sensation, we're really going to be looking at muscles. And another research study came out that I highlighted in our magazine from UCLA that talked about the bladder subtypes. So UCLA, so remember, that's what we're doing now is all doctors around the world are now trying to come up with their perfect subtyping system, right? And so UCLA threw their hat into the ring with their own proposal, which is very, very similar to Chris Payne's proposal. Let me grab this here real quick because I thought it was cool. Hold on a sec. I've got to go to 2022 winter. Where is it? Okay, this is from my editorial. Okay, so UCLA released their first quote subtyping proposal, and they were trying to create subtypes or phenotypes for 520 women with pelvic pain. 145 of those patients had very clear bladder issues, so they were treated separately. They found a bladder pain group with 56 patients who reported pain as their bladder filled with urine that was relieved by urination. What have we been saying for a decade now? Pain that gets worse as your bladder fills with urine that is relieved by urination points us to the bladder wall. Then their second group was 31 patients who had all the symptoms, frequency, urgency, pressure, pain, but they had pain in their urethra and pain at the entrance to their vagina, and they struggled with painful sex and painful urination. And their pain was persistent regardless of bladder filling, right? So they believed that this was pain coming not from the bladder, from outside the bladder. And then the largest subgroup was the myofascial muscle group. Again, Group 3 had 58 patients with nearly identical pain levels, urinary symptoms, severity, and quality of life as the bladder group, but they had more symptoms related to the bowel. They had frequent sensations of incomplete emptying and small amounts of urine leakage. These patients reported more pressure, heaviness, straining, and they had the most bothersome symptoms on physical exam that when you touch muscles, it hurt. That was the myofascial pain group, right? So again, where is your pain located? And then last but not least, if you've got multiple pain conditions, IC, IBS, vulvodynia, super sensitive skin, a wicked sense of smell, then we're really going to be looking at the central nervous system. If you're struggling with massive anxiety disorder, and you can't kid a kidder, hello, this was me in my 20s and half of my 30s, massive anxiety disorder associated with all the health struggles that I had. If you have that, then that tells us that your central nervous system is involved. And we know what that's all about. We know that that's central sensitization because your brain is stuck in fight or flight. It's not a mental illness. Nobody's saying it's a mental illness. It's that your brain has been habituated into thinking that your life is at stake every moment of the day. And in the research on that, 80% of the children that this eventually happened to had a major physical trauma, like being hit by a car, breaking a leg, and 20% were being abused or being bullied. And either one of those 14 days of severe pain will put your brain into fight or flight. 20 days of bullying will put your brain into fight or flight. And if you were bullied your entire childhood because you had an abuser in your family, you have to think about the toll that takes on your body, that your brain, literally your central nervous system, is trying to save your life. And so it's keeping you in fight or flight. But there's good news here. We know exactly what to do to get you out of fight or flight, and that's mind-body medicine. Good sensory information. We can go through that later. I don't want to do that right now, but I've talked about this extensively. One of the reasons, I'm in that group. I had frequency urgency in 7th grade. I had vulvodynia in high school. I had IBS in my 20s, migraines in my 20s, sensitivity in my 20s, IC in my early 30s. And I had massive anxiety disorder that whole time. I've shared why, that I grew up in an area where we had a rapist and murderer who raped and murdered my neighbor. So I was afraid to walk out of my house for years. Ironically, our local paper just did more stories on that, which is crazy. In the early 70s, when I was 12 years old, 13 years old, 14 years old, all these young girls were taken. So sad. So there's a toll that takes on the body, and your brain ends up in high fight or flight. All right. So for those patients, it's not just going to be pain management, honey. It's going to be calming your central nervous system down. It's going to be working on that anxiety, because when you're anxious, your body and your brain intensifies the pain because it thinks you're a fight or flight. When you're laughing, your brain minimizes that pain. So we have very different strategies now for people who have multiple pain conditions. And the reason why I'm better and I don't have anxiety disorder anymore and my body is massively calm now is because I found an excellent anxiety management class that I took when I was 35. I had a single panic attack since I took that class, and I absolutely believe that's one reason why I don't live with pain every day anymore. I have told my brain I'm safe. I'm safe. I have a roof over my head. Thank the Lord. I have a roof over my head. I have food. I'm safe. Not that we don't understand the struggles of other people. Life is hard right now. Very, very hard. So Sandy, I'd be happy to talk with you at some point in time if you'd like to talk next week. What I do have is allergies right now. Like both of my ears were plugged yesterday. The trees are blooming here in California like mad. Joan says, how often do you apply estradiol? It depends on what your doctor sees. If you have severe estrogen atrophy, sometimes doctors will have you apply it every day for 2 weeks and then go back down to 2 or 3 times a week. Well, nobody here can give you medical advice like that. I can't give you medical advice. You've got to follow your doctor's instructions. So Kimberly says here, I don't take anything else for IC. The same year I got gynecologist who put me on the estrogen cream, took me off of all other oral meds. Physical therapy helps me a lot. My treatment plan is diet, physical therapy, and physical therapy. Yeah, exactly. Alexis said I had a mass in my somethings in your ovary. So you had an oophorectomy on my left ovary. You still have your right one. No problem with needing estrogen. Okay. Karen says, my bladder has been so sensitive and flaring quite often ever since I had that rare yeast infection in December. Do you think it would be worthwhile to get a Microgen DNA test? Absolutely. Why not? Why not? We had another Candida study that came out a couple weeks ago. And this was, I think, also done at UCLA or USC. When University of California, LA has an excellent research center. I went to UC myself. That's where I got my pharmacology degree. So they were studying the presence of fungi, Candida, in the urine of IC patients, and specifically in the urine of patients who have bladder pain. And what they found is that the patients with pain versus the patients without pain, the patients with pain, the IC patients with bladder pain, had a more aggressive, virulent Candida that was killing more cells. And so having a next generation urine test to see if you still happen to have fungus in your urine, I think is a brilliant idea. John says, is there an equivalent to estrogen-induced dryness in men? You know, John, I have wondered about that myself, and I've even sent emails out to a couple of other people asking about that in the last 6 months, and nobody has been able to give me an answer on that. I mean, clearly our skin changes over time, whether we're a man or a woman. And so I do think that the bladder wall of a man is going to change as they age. I just don't necessarily understand the hormonal influences that would be driving that. Would it be a drop in testosterone, and does that also do that? It's interesting. I would like to try to get an answer for you. I have tried to get an answer for that question before. As Susan says, I use Estradiol, and I find the extra squirt from 2 to 3 is a game changer. Excellent. Kimberly says I had a gastric bypass in May. It seems my IC's gotten worse. Well, so Susan, I'm going to bet that because you had the gastric bypass, they put you on a lot of new vitamins. And you have to look at the vitamins. If the vitamins have a lot of vitamin C in the form of ascorbic acid, that's probably what's burning your bladder. I've worked with gastric bypass patients before, and that vitamin regimen is rough on an IC bladder. So you're going to need to talk to your doctor about it. Maybe they can mix it up. Maybe they can give you something that has the low acid vitamin C in it instead, which we call calcium ascorbate, rather than ascorbic acid. So I bet my money it's a vitamin they've got you on. Peter says, what foods or supplements can help? Well, we have a whole section on diet over on the IC Network website, icnetwork.org. Go on over to the website, start there. Basically, food modification, it's about reducing and removing those foods that are high in acid, high in caffeine. They're going to irritate the bladder wall or tweak the nerves that will make you pee more. Hello, Donna. Nice to see you, hon. In terms of supplements, it's all about what your subtype is, hon. It's all about what your subtype is. So Peter, I'm not sure if you're a man or a woman. I'm going to assume that you're a man. But sometimes it's a wife using their husband's account. So if you could clarify that with me, that would be great. We had somebody asked us a question on Amazon, in our Amazon store 2 weeks ago, and they said, what supplement will heal the bladder? My answer was, no supplement will heal the bladder. The only thing that will heal the bladder is the bladder, right? So our job is to create an environment that will support healing in the bladder. And so again, if you're pouring acid on your bladder every day, listen, nothing's going to work. The patients who suffer the most are the patients who, they'll put tens of thousands of dollars into trying therapies, but as long as you're drinking that coffee every day, the other therapies are not going to work, because acid on a wound, especially if you have Hunner's lesions or estrogen atrophy, is going to prevent tissue healing. So number one, you have to modify your diet. And then number two, in terms of supplements, it depends upon what the underlying pathology is. If you have chemocystitis and your bladder wall has been damaged by the chemicals from chemotherapy, then doing something that might be soothing might help, will help address some of that nerve inflammation that's going on around there. And so you could try Allopath, you could try George's Aloe drink, you could try Desert Harvest Aloe. You could give any one of those a try to see if that might be a little bit soothing, but that's not going to fix the bladder. But if there's a clear bladder wall defect, like estrogen atrophy, then the supplements that contain chondroitin are the ones that have the best effect at kind of creating the equivalent of a chemical Band-Aid on the bladder wall, over the bladder wall, to protect that tissue while that tissue is trying to heal. So you'd be looking for Cystoprotect, Cystorenew, Bladder Builder, Bladder Rest, Cystomend, things like that. And then if you're IC subtype 5 central sensitization, or you're struggling with a lot of nerve irritation, then, you might want to look at PEA, palmitoethanolamide, which is known to calm nerves down. And we had research released in 2019 at the International American Urology Association conference, where they used PEA, the simple supplement from Europe. It's a simple fatty acid, extremely well tolerated. And they gave that to IC patients. And by month 3, 87% of patients were reporting a significant reduction in pain. And by month 6, quite a few patients were now pain-free. And because my subtype is more muscle and nerve, I don't do the chondroitin-based supplements or aloe. My bladder's good. I work to calm my muscles down and to calm my nerves down. So I personally use Peora. So it depends upon what your unique case is. We're the equivalent of apples, oranges, and bananas, right? There's a lot of diversity in this patient population. We don't all respond the same. There's not one supplement that will work for everyone. There's not. Impossible. It's impossible. So it depends upon your unique presentation. All right, who's texting me? Somebody's texting me. Oh, damn. You know how much our QuickBooks costs us? QuickBooks now costs $2,500 a year. Used to be $2,500 every 3 years. This year, $2,500 a year. Holy moly. All righty. Okay. Alexis says diet Sunkist and lemonade helps with stones. Well water, best to boil your water. Got to be careful. Obviously, listen, if you got kidney stones and you got IC, you are stuck between a rock and a hard place. If you got kidney stones and you got estrogen atrophy, that means that your bladder wall is weak and vulnerable, and it's not going to be able to tolerate the diet, the Sunkist and the lemonade. God forbid it be diet. Because if it's NutraSweet is metabolized into formic acid and formaldehyde. If you look at the FDA approval for NutraSweet, bladder irritation is a well-known side effect of using artificial sugars. So doing something like Diet Coke or any diet drink is a double whammy, because you're getting not only the acid in whatever the flavor is, combined with the acid of the artificial sugar when it's metabolized. Judy says, can low vitamin D affect the bladder? I don't know. Vitamin D is associated more with bone health, right? Oh, Alexis says, well water causes stones. Not all well water causes stones. Some well water causes stones. That's why if you have well water, it's always really good to get it tested by your county once every couple of years to make sure it's not contaminated. Peter says, what can heal the bladder wall? Peter, I just went into that. There's no therapy that will heal the bladder wall other than maybe platelet-rich plasma. This is about creating an environment that will help your bladder wall heal. And I'd be happy to work with you directly in person to truly try to help you understand that. Joan says, does D-Mannose have any side effects? Not that I'm aware of. Alexis said you had your lesions burnt. They still hurt. Did they do a steroid injection? Steroid injections into the lesions often help when the fulguration doesn't. And we now have research that says hyperbaric oxygen therapy can also help. Judy says, can a steroid shot in the shoulder cause a flare? Maybe. Well, okay, so I had steroid shots in my back last year, and because I have compressed discs, and I will tell you that for the first time in my life, I had back pain where they gave me the injections. I don't know if that could spread to the bladder or not, though. So hard to imagine a steroid shot in your shoulder affecting your bladder. I don't know. Good question for your doctor. Marcia says, do Hunner's lesions always are Hunner's lesions always determined by cystoscopy? If they aren't seen in cystoscopy, does that mean? So Marcia, Hunner's lesions are identified with hydrodistension with cystoscopy. Some Hunner's lesions you cannot see in a plain office cysto. It requires that stretching of the bladder, a slight stretching of the bladder to identify where the lesions are located. Alexa says pre-leaf makes her sick. Possible. It's rare. Pre-leaf has like literally the best side effect profile of anything out there, but we are all unique. I absolutely believe you if you say that it triggered you. Just like for me, I could only take one cystoproject. I couldn't take two. If I took two, I had stomach and bowel issues myself. Jeannie, I like your answer. She says, I had many cystoscopies and it took a real knowledgeable urologist to finally find them. That's true. You know, you got to understand that medical schools don't teach how to identify a Hunner's lesion on hydrodistension. Usually that's extra training that they've gone to, maybe at the American Urology Association conference, if they actually go to the urology conference. Karen says, can you fall into more than one subtype? Absolutely. If you've got Hunner's lesions, I can guarantee you're going to have pelvic floor pain because your muscles get tight to compensate you from the pain. I call it the chicken versus the egg dilemma, though. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. They're both involved. They cannot not both be involved. They're so interconnected, they are both involved. But one is normally driving the other. So we have to figure out what's primary and what's secondary. So if your symptoms began after chemo, then we know that it all began with chemical irritation of your bladder screaming in pain from the chemo. Your muscles get tight in the guarding reflex to protect you from that pain. You can't stop that. That's an autonomic response. So basically, our therapeutic priority for that patient is going to be to calm and soothe the bladder. We want to get them off of chemo get them through, not off, through chemo. Maybe use Mesnex during chemo to try to reduce some of that superficial bladder irritation from the chemo. So, you know, again, our therapeutic priority is to reduce the chemical irritation, create an environment for the bladder to heal, hopefully hoping that the muscles will now relax now that the bladder is no longer screaming in pain. So that's very different from the far more common scenario, because I personally believe that the far more common scenario, and again, the UCLA study kind of proved this, that it's pelvic floor injury that is a triggering event for many of us. And, but you have no clue you have a pelvic floor injury. Your first symptom is frequency, urgency, pressure, pain. You're sure it's a UTI. You call the doctor. Yes, it's a UTI. You ask for antibiotics. They give you the antibiotics. You might even feel better with the antibiotics because it has a nice anti-inflammatory effect. All right. But eventually things come back. And you go back to the doctor, and the doctor goes, all right, let's do a urine culture. Comes back negative. Multiple urine cultures come back negative. You're going, what the hell? Come on, my bladder's screaming. I have to have an infection. But it comes back negative. You might even do a next-gen test, that comes back negative. You have no fungus, no virus, et cetera, et cetera. So then the doctor will say, oh, I hate to break it to you. I think you either have overactive bladder or this rare incurable bladder disease called interstitial cystitis. Here's your diet. Here is Elmeron. I'll see you in 6 months. And you know, you're a good girl, a good guy. You want to get better. You go home, you follow the diet, you take the meds. You ask for more meds. It's not helping. Can you give me something to sleep at night? They give you something to sleep at night. And before you know it, you're on 3, 4, 5, 6 medications. You might be on Elmeron, you might be on amitriptyline, you might be on hydroxyzine, you might be on Baclofen, vaginal Valium suppositories, whatever. And the reality is that the symptoms are still there 5 years later, 10 years later, 15 years later, 20 years later. And what the American Urology Association guideline says is, hey, listen, if you're not responding to therapy, take a step back and reconsider the diagnosis. Have you missed something? And guess what? Yes, you missed something. The freaking muscle injury. The consequences of a muscle injury are profound. If you fell and broke your tailbone, if you were a gymnast, if you were a cheerleader, if you were a football player, if you were an ice skater, if you were a paratrooper, anything that involved repetitive pelvic trauma to your pelvis. Again, if you broke your tailbone, if you had, or you broke your hip or your SI joint, or if you struggle with massive levels of anxiety, because if you're stuck in fight or flight, your muscles are tight. You can't stop that. Your body's preparing you to fight or flee. It raises your heart rate. It raises your blood pressure. It tightens your muscles. If you've had anxiety disorder for 20 years, you've had tight muscles, artificially tight muscles for 20 freaking years. A therapeutic priority for that group is not bladder therapy. It is, in fact, pelvic floor therapy to restore blood flow. Because when your muscles are tight, you don't have good blood supply. The bladder doesn't get the blood it needs. The pelvic, the other organs don't get the blood they need, and you end up with ischemia. And again, the UCLA subtyping study that I just talked about 10 minutes ago clearly identifies that patients with the myofascial component, that 80% get better with physical therapy. So a lot has changed. Everything we learned about IC 20 years ago, 25 years ago, even 10 years ago, thrown out. You guys are apples, oranges, and bananas. For God's sake, that's the first thing you've really got to understand. You cannot compare yourself to anybody else. If you have tight muscles or a broken tailbone, your path of the condition is going to be very different than somebody with Hunner's lesions or chronic UTI. You are an anatomical mystery to be solved. In medicine, they say you're a snowflake. Every snowflake is different. We are the equivalent of snowflakes. All right. Alexa says, it takes 8 years after straining to repair why you need a relaxer. Right. Survival mode. Yeah. She said mine started 30 years ago after having a child. And we see that when in earlier research studies about kind of risk factors, a number of patients reported that their symptoms began after childbirth, especially a traumatic childbirth, especially if you ruptured muscles or you had tears or a pubic symphysis. One of the patients that we worked with, and she might even be here. Here, hold on a sec. Let me get my model here. Jessie, girl, you hold on tight. I'll be with you in just a minute. I'm about 20 minutes behind on Facebook with your questions. Sorry. All right. So here's your pubic bone. This is your pubic bone, right? But it's actually two bones that are connected. And this is called the pubic symphysis. It's a connection. But sometimes during childbirth and after traumatic injury, this joint becomes very unstable. Can you imagine how much discomfort you would be in if these bones were not stable and they were moving? So one of our members, took to heart what I said about we have to look at our bones, and they discovered she had a severe defect in her pubic bone. Probably, I haven't talked to her in a while. If you're in here, call me. I want to hear how you're doing. I'm going to bet that they had to do surgery to repair that. Jessie says, I'm in extreme pain and it's not getting any better. I've done everything possible I can think of to relieve pain, but I'm starting to panic. Okay, so Jessie, number one, deep breath. Let's all take a deep breath in and out. Let's do it again. In. And let's do a slow out. Okay. If you're not responding to therapy and the bladder therapies are not working for you, it's time to take a step back and let's revisit this diagnosis. What did we miss? What did we miss? The bladder, let me get this. Hold on a sec. I need to get these two books. Whoops. Okay. Dr. Jerome Weiss is I just think he's brilliant. And he has this incredible book called Breaking Through Chronic Pelvic Pain. This book taught me more in a month or two than 20 years of my own research, as well as, serving on the IC research panel, because this is a book about muscles and bones. And one of the things that he says in this book that's just so incredibly important is Western medicine fails the pelvic pain patient. Why? Because doctors like to stay in their sandbox. Urologists stay in the urinary tract, gastroenterologists stay in the bowel, gynecologists stay in the reproductive tract. They don't look at influences. They do not look at all the things that influence the behavior of the bladder and the bowel. They're connected. There are connections in there. The second point that he makes is you have to really think about how crowded it is in this pelvic cavity. So I'm just to give you a slam dunk here, just to kind of prove to you why these influences matter here. It's always so weird that whenever I do these meetings, my head itches. I just don't understand why. All right. So let's look at the pelvic cavity here. And I apologize, I don't have a male model. I tried to get one and I couldn't find one. So we're using a female model. So for guys, you don't have part of these bits. So we're going to put in first the vagina and the uterus. And they even have magnets to attach. Look at that. One thing to know about the vagina and the uterus, if we look at this right here, is that it is attached by ligaments. It is held in place by ligaments. And if one of these ligaments is broken, it can start moving. It can even swivel back to front to back. All right. This next thing we're going to put in here is we're going to put the bowel in here. So the bowel is going to go down the left side. All right. So now the bowel is now attached. It's actually attached where it's supposed to be in the model. And now we're going to put the bladder. Now, all right. Is that right? I'm looking, there are all these magnets here. The little tiny magnets in here. All right. Well, in any case, whether I have this correct or not, I think it's like this. I think a magnet fell off. Okay, bladder pain is very centered, right? So bladder pain is directly up above your pubic bone. It is not to the left or to the right of center. Bladder pain is centered. But you got to understand that look at how crowded this cavity is. And then you got to throw in all the big giant blood vessels going through there. And you got to throw in the nerves that go from your spinal cord, right, through your pelvic cavity down into your legs. And then, of course, we have these big skeletal muscles here. These are muscles that help you move your legs. They will help you bend over. They help you pick things up. I mean, these are skeletal muscles essential to the functioning of the human body, walking, running, jogging, whatever, right? Skeletal muscles also help women have babies, right? So anyway, so we've got skeletal muscle too. So concept number one is to prove that there's influences here. To prove that there's influences here is, can a organ like the bladder change muscle behavior? And the answer is absolutely yes, it can. If your bladder's screaming in pain, your muscles will get tight to protect you from that pain. That's called the viscerosomatic reflex. But the far more important question is, can muscles change organ behavior? And the answer is yes, because if you have a muscle injury, let's just say here. So look, here's your tailbone. Here's your sacrum, that triangular piece of bone right there. Here's your spine. So you got your spine, you got your sacrum, you got your tailbone. And, one thing about the tailbone, why we see so many tailbone injuries is look at all the structures that attach to the tailbone. It helps balances the left and right side. So muscles attach here. So if your tailbone is healed out of position, one side is going to be stretched and one side is going to be contracted, right? So abnormal muscle tension patterns can happen. So if your muscles are tight, we are now in ischemia. The muscles are lifting, they're contracting, you've got trigger points, you got big muscle knots, they hurt. And eventually, you end up with ischemia. You get oxygen deprivation. That the blood flow is substantially limited, and it starts affecting everything else. Once blood flow gets limited to the organs, the other hard reality is the blood flow is limited to the nerves, and the nerves need blood supply to function. The nerves have to have blood vessels next to them to help them conduct a nerve impulse. And so if you don't have good blood supply, your nerves are going to be messed up. All right, I need a ponytail. My head is being weird. Where is it? Ah, there it is. Hold on a sec. Sorry. It is what it is. All right, hold on. I got to tame the beast. I'm going to come back. I'm warning you right now. I'm going to come back with short hairs. Sometime in the next couple months, it's going to be short again. All right, hold on. Is that good? Does it look okay? Well, it's the best I can do. Okay, stop it. Okay. Deborah says, why does Facebook have to access your credit card to give you stars? Because stars are the equivalent of donations. And and believe me, they're tiny donations, like pennies. The last time whoa, runaway pelvis. Stay. All righty. Karen says, I'm in fight or flight mode because you were bullied by your brothers growing up. Okay, but you're grown up now. We are grown up now. The stressor is gone. And we now have to work hard to tell our brain that we're safe, right? You don't have to live there. We have to retrain our central nervous system out of fight or flight, and it works. Laura says, I've been taking 50 milligrams hydroxyzine every night. It has helped, and now I've read that it can cause dementia, so now I'm worried. So hydroxyzine is in a class of medications called anticholinergics. That also includes the low-dose antidepressants, as well as the muscle relaxants like the Flexeril and the Baclofen. And it is true that anticholinergics have been linked to increased cognitive decline, that if you take it every day for 3 years or longer at a substantial dose, there is a substantial risk of cognitive decline, seen not only in the elderly, but also seen in patients in their 20s. And so, Laura, it kind of raises an important question, and that is the medication helping you? When I was getting my pharmacology degree, they taught us a concept called the lowest effective dose versus the highest effective dose. The lowest effective dose is what's the least amount of medication you can take and still see a beneficial side effect. In other words, more is not better. And for those of us who have central sensitization and we're already really wickedly sensitive, we don't like taking a lot of anything anyway. I don't. I am the queen of weird side effects. I mean, I took one Bactrim GS and my ears started roaring and they've never stopped. Literally one preventive antibiotic to reduce the risk of UTI after sex because I had a new guy in my life. One pill changed my ears forever. And I live with constant ear ringing that's really quite loud at times. So I come from the school of the least amount, what's the least amount you can take and still get a beneficial effect. So maybe you can talk to your doctor about reducing that dose. You know, when I took hydroxyzine, I took a 25 milligram capsule, but my doctor had me cut the capsule in half. So I was only taking 12 milligrams. So maybe you can ask him if you can reduce that dose, right? Or maybe you could consider trying some of the supplements and seeing if the over-the-counter supplements that don't carry that risk of dementia might be just as effective for you. Alexa says you had a dermoid mass. Yeah. Karen, thank you again for the 500 stars. So much appreciated. Becky says, I'm a woman and I was using both estrogen and testosterone cream. The combination works for me. Estrogen alone wasn't doing it. Yep. Joan says, is citric acid just as bad in vitamins as ascorbic acid? Yep. Joan says, are strawberries acidic? Yes, they are. Strawberries, you know, the thing with fruit, and the problem with a lot of the strawberries we get in our stores is that they literally pick them before they're fully ripe, and they wait for the ripening to happen in boxes and on shelves. And as that fruit, so an unripe fruit is very, very acidic. And as it goes through that final ripening process, the acids levels drop as the sugars increase. And so, you know, if you grow strawberries in your yard, that might be better because you can eat them and pick them when they're truly, truly acidic. But here's the other thing about strawberries and berries, and that is the Environmental Working Group is a nonprofit that focuses on the quality of our food. And every year they release something called the Clean 15 and the Dirty Dozen. And so they go through our own FDA's food quality data to put that list together. So this is research from the US government that they quantify and publish. And strawberries are one of the absolutely most compromised by fungicides and pesticides. I hear in California, strawberries are grown, and it's really tragic what they do because they literally destroy everything in the soil. The worm, everything is gone. Massive chemicals in the strawberry fields. Then they put plastic down. Then they plant the strawberries, and they're heavily, you know, chemically treated. And so that chemical treatments end up in the meat of the strawberries. So if you're going to get strawberries, I only buy organic strawberries. I would never buy non-organic strawberries. Their website is ewg.org. E for environment, W for working, G for group. And let's just see. Let's just see if they've released a list for this year. Though they haven't released the one for this year, it's going to be in another 2 months. But let's just see what the oh yeah, so the worst food for pesticide contamination on their list were strawberries. Number 2, spinach. Number 3, kale, collard mustard greens. Number 4, nectarines. Number 5, apples. Number 6, grapes. 7, cherries. 8, peaches. 9, pears. 10, bell peppers. 11, celery. 12, tomatoes. So you can just Google Dirty Dozen 2021, and you can read all the research, all the science behind it. So generally, those are the foods that you absolutely want to buy organic. You know, last year, for example, the grape contamination was shocking. In raisins, holy hell. Like every single grape tested was massively contaminated. And even like, I think if I remember correctly, 96% of organic grapes were also heavily contaminated with proven cancer-causing pesticides because a lot of them come from international. Let me just see what the Clean 15 is. Let me see if I can find that. So the best foods, the foods they say you can buy and not organic: avocados, sweet corn, pineapple, onions, papaya, frozen peas, eggplant, asparagus, broccoli, cabbage, kiwis, cauliflower, mushrooms, honeydew, and cantaloupe. So the clean 15 and the dirty dozen. Kimberly said, why were my dilations working for so many years? Now they don't help at all. I used to get dilations done. I would get relief for 8 months. Well, Kimberly, you've got to think about, you got to ask yourself the question. So if you're doing a urethral dilation, that's because your urethra is narrow. So what they do is they use a metal device to stretch the urethra, right? But today they call that raping the urethra. And in fact, at a conference, at an IC conference that was done, or AUA conference class on IC, a international urologist asked the American panelists why they don't do like dilations, and the doctor said, we don't rape the urethra anymore. Instead, we focus on what's causing causing it to be so tight in the first place, which is, hello, the levator ani muscles. So it's much better to do the muscle therapy and try to work on muscle health over time rather than forcing it with a metal rod or wand. Anne says, so you can use a bladder cysto instead of estrogen? Absolutely not. No. Estrogen works on the skin. A bladder cysto is going to break nerves, and you might feel better temporarily, but it's not going to get you where you need to be in the long run. We've got to focus on healing that skin. Alexis says cystoscopy is done in the operating room. A hydrodistension with cystoscopy is done in the operating room. A plain cystoscopy is done in the doctor's office. I call it a looky-loo, 5-minute test. Samantha says, is stevia okay? If you're flaring, I would pass. Debbie says, does D-Mannose help? No, D-Mannose will do absolutely nothing for a wounded bladder. What D-Mannose will do is will help if you struggle with recurring E. coli infection. Alien says, we need a new name for Alexis. My Alexa keeps going off every time you say her name. Oh my God, that's funny. Becky says, I used to drink Diet Coke all day. It really messed my bladder. I feel better now 9 years later. Yeah, you know, the human body was not designed for Diet Coke. Jeannie said, I've had 5 cystos in the doctor's office. They were without hydrodistension. The cysto alone is okay in the doctor's office. Yeah, it usually is. I've had it done twice myself, and just a plain cysto alone, I mean, they're just going to numb your urethra with lidocaine or a lidocaine jelly, usually stick a cystoscope in, take a quick look around, pull it out, you're done. And the only challenge recovering from that is just going to be your urethra is going to be irritated for a day or two. So peeing the first time after a cystoscope or a catheterization is not fun. No siree, Bob, not fun at all. Joan says, should you take D-Mannose daily for preventative UTI or just when you have UTI? D-Mannose is not a therapy for active UTI. It's considered preventative. Yvonne says, been in a flare for a week. All right, Yvonne, what do you think is causing your flare? Lisa says, Jill, I'm having a cystoscopy and third hydro installation this week. What answers should my urologist be able to tell me afterwards? Well, let's see what your bladder looks like. That's it. It's what does your bladder look like? Is there anything unusual in there? Any red spots, any bladder stones, anything at all like that? Becky says, I used to be able to tolerate pre-leaf. After seeing a gastroenterologist and getting my constipation under control, I tried pre-leaf again. Now I can use it. I'm so happy about that. Deborah, I don't know. You can always pull your credit card off of Facebook. and just delete it from your account. Donna says, where I live, we have water leaks. I get some contaminated water in me. I had to take metronidazole for 10 days. You now got thrush. Yvonne says, do you know of any doctor looking at the ligaments as a cause here in the U.S.? We can go to the case study that was published. If you go to our website, go to my blogs. I did a blog on this patient with Hunner's lesions who was miraculously cured by repairing the ligament. And you can see who it is there. Alexis says NSAIDs here in Texas have had a lawsuit against them for renal failure. Yeah, if you use way too much, absolutely. Lots of tailbone injuries in this patient population. Kegel exercises do not work. If you got pelvic floor dysfunction and pelvic floor tension, you do not do Kegel exercises. Kegel exercises will absolutely make it worse because the muscles are already tight. Kegels are designed to tighten muscle. Why would we tighten muscles that are already too tight? It's not about the contraction. It's about the relaxation. It's about restoring normal muscle tone. So, Alexis, you are wrong on that one. I say that with love, hun, because we're all learning. Karen says, what do I think about Sola physical therapy? Does it work? Isn't that the, hold on. Let me just refresh my memory here. Deep tissue photobiomodulation. By Angie Storr of the Storr Center. And I love Dr. Storr. She's wonderful. I think she's the author of that great book, When It Hurts Down There, that I recommend for everybody with pelvic pain. I think it's worth a shot. I think you just need to ask about the pros versus the cons, the risks versus the benefits, and have they had any complications? And if so, what are the complications and were they able to fix the complications? Deborah says, I believe everyone should call the IC Network to buy your stars. Hon, we don't sell stars. Only Facebook sells stars. That's how Facebook handles little donations and stuff like that, ways for people to say thank you for live events like this. But you can absolutely call the IC Network and become a member or make a donation directly to us if you want. I mean, if you've attended these meetings, and I've done these meetings now for years, I don't solicit donations for the IC Network. It's rare. It's very, very rare. I am a rebel. I think that money raised in a state should stay in that state. This is one reason why I was challenging for the ICA is when we did events, I was very clear. I wasn't going to send the money to the ICA headquarters. I wanted to fund research that would benefit patients in my state, in California. And that's what we do with everybody who asks to make donations. I have a donation and giving guide on our website. And if you want to donate to research, donate to the research center, directly to the research center. Don't donate to us, donate to anybody else, donate to them. That way, you know, all the money will go to that research. But, you know, if you find what I do helpful and you want to support what we do here at the IC Network, it'd be great if you made a donation here too. But I rarely ever ask for it. I think it would be great if you became a member and you got our magazine. I think that you would get something back from us that I think would be really helpful, like our magazine and back issues of the magazine and freebies and books and things like that. Shirley said, my first urologist told me if I had a vaginal delivery, not a C-section, my IC would be worse. Well, it would certainly be more traumatic to your pelvic floor, but that said, the C-section is also traumatic too. I wonder why. Maybe you're just very, very small and they didn't think the baby could pass through. Rhonda says, thank you for doing the pelvic model. I finally have a referral to pelvic floor physical therapy tomorrow after the accident with the 18-wheeler in August. Good luck, honey. Good luck. It is a win. I believe it's going to be a win. Marlia said, God, holy crap, you guys are asking a lot of questions today. Woo! Let me get a little drink again. Wow. Okay. My doctor gave me tizanidine because I have fibro and very tight muscles nonstop. The tizanidine helps me, but then I read on tizanidine can cause blood in the urine and UTIs. I've had both. With your pharmacology knowledge, do you think that it will cause UTIs? I don't know, hon. I don't have any experience with that. I'm sorry. I have zero experience with that medication. I just can't help you. Generally the pelvic floor skeletal muscle relaxants that are most commonly used in the IC patient community are going to be Baclofen. That's number one because there's no sedation to it. So you can take it during the day and you can work and drive and there's no issues. Or Flexeril, also known as cyclobenzaprine, or Valium. Lisa says, how could a C-section be worse for IC? Well, think about it. Your vagina and your uterus are literally right next to your bladder. They touch each other. They're attached to each other. And so you're always going to run the risk of trauma to the bladder with any sort of pelvic surgery down there, especially hysterectomy. That's why if you're having a hysterectomy, they almost always do a hydrodistension just to make sure they didn't accidentally damage the bladder. Lauren says, my urogyne did an endobiopsy on Thursday. He put me on a progesterone to make my period go away because I've been bleeding for 4 months. Definitely helped, but you're still spotting daily. When he did the biopsy, he said, you're bleeding. You should get an IUD. I'm scared to get an IUD. I can't even tolerate a tampon. I'm reading a lot about IUDs not being good for pelvic floor. Pretty sure my IC is pelvic floor related too. He said, because I was still bleeding. When the endobiopsy was done, he said it may need to be done again because it came back as inaccurate. He said, you've been to the doctors. You've been to 6 doctors. It's time to trust that you are in good hands. I'm thinking I've been in this body for 44 years and dealt with IC for 7. I know my body more than he does. What do you know about IUDs and IC patients? Why would you take something that can cause bladder pain? I'm constantly battling bladder pain. God, Lauren, that's a hard question. That's a really, really tough question. Again, cause versus effect. Cause versus effect. So what he is proposing is that an IUD will help some of your underlying challenges. So number one, you're bleeding. And you're bleeding so much, you could become anemic. And so it's completely normal with somebody who's bleeding a lot to consider using hormones to try to control that. And so I completely understand why he's suggesting an IUD. The question is will you and your body tolerate the presence of an IUD? And that's where it gets a little bit tricky. I think that a reasonable counter proposal to him would be if you could do an oral birth control and maybe some pelvic floor physical therapy to see if you can get the muscles calmed down before you would consider an IUD. That might be a reasonable counter proposal. I guess the other thing, if he says, no, I want you to do the IUD, I think my response back to that would be, I would be willing to try it if you will commit to me right now that if I have a complication from it, you will take it out immediately. Because remember, Lauren, you're the boss. They're not the boss. You're the boss. You're paying them. They're not paying you. You are the one who is going to be making the ultimate decision. And you have the right to have a bargaining. You can bargain. And bargains can be good and bargains can be bad. I mean, with my uterine cancer, I bargained and it was terrible. I should never have done that. Should never have done what I did because I delayed getting my biopsy for 6 months. If I delayed any longer, I could have had much, much, much more severe uterine cancer. I was a damn lucky that everything fell in my favor, right? Are blueberries acidic? No. Well, again, riper the better, but blueberries and pears are considered the best one. Donna said, is California doing a good job with COVID? I think people are insane. we have a lot of COVID. There's still a lot of COVID. There's still a lot of active infections here. And I just think that we all have to make our own decisions. We have to make our own decisions. I, for one, intend to mask, if not double mask, for the foreseeable future in groups. Because number one, I haven't had a cold or the flu in 2 years. I like that. I prefer not having the cold or flu. But number two, I want to protect my family. And I'm the one who could bring COVID back into the house since they don't go anywhere. We also have a new variant coming from Denmark that is really bad. Like really bad. It's a much more contagious, much more severe Omicron that causes more cell death. So, and they believe that the reason why that's risen in Denmark is because Denmark took away all the protections about 6 weeks ago or 2 months ago. It's really tragic. Joan says, I have a Taylor cyst on my tailbone, a Tarlov cyst. Can this affect the bladder? Yes, it could. It could. Tabitha says solotherapy did not help her. It was painful and not covered by insurance. Hi, Denise. Denise, you said my name. Hi. Ann says, any good urogynes in New Jersey? I can pull up my database towards the end of the meeting and we can look. Denise says, Jill bought Dandy Blend to make iced coffee, but I have IBS. I'm afraid it will trigger it. Do you oh, God, girl, that hasn't touched my eye. No, it's fine. Oh, you have 5 months of no taste due to COVID. Oh, wow. Oh, man. Denise, by the way, I just last week was reading a article on, they had a protocol to try to train your brain to start smelling things again. And it involved smelling like 5 or 6 things and just trying to retrain that portion of your brain. So you should Google that, retraining for improving your sense of smell after COVID. I don't see how Dandy Blend would irritate your bowel. I had years of IBS, very, very painful IBS in my 20s. At Dandy Blend, in fact, I have it right here. This is a Dandy Blend Frappuccino. I've never had any bowel issues with it at all. Ravonda says, will IC 101 be available? I'm trying, hun. I'm trying to get it done. It's just, I need, like, the only time we can record, like, I want to do the Audible. I want to be the one recording the Audible because I can pronounce all the words. I don't want to hire somebody to do it. I want to do it. But like the only time I can do it is the middle of the night. So I'm just going to have to commit to being up from like 1 to 5 a.m. to do it. It's hard. Thank you, Deborah. Alexa says, do you get an infection from any type of water? You get an infection from contaminated water. Mary says, so if your pelvic floor is too tight on one side and relaxed on the other, what do you recommend? It's going to be hands-on physical therapy on the tight side. That's what I have. My muscles at first were super tight on my left side and my right side was normal. So we worked massively on my left side and now it's reversed. So now my left side is good and it's my right side. And so when I do my internal wand work, I'm going to focus on the tight side and trying to get those muscles to relax. Judy said, I would like to try the Dandy Blend, but I don't think it's gluten-free. Let's see. Let us see here. So here's the Dandy Blend. For anybody who's interested. Love this stuff. Love, love, love this stuff. I'm in love with this. So it's 100% caffeine free, no acidity, no bitterness. And they have recipes for a dandy shake, how to make cafe au lait, cafe mocha. Oh, interesting. I don't see any no additives or preservatives, made from water-soluble extracts of 2 roasted roots and roasted grains. Gluten from barley and rye, which is insoluble in water, is eliminated in the water extracting process. So there you go. The gluten from barley and rye, which is insoluble in water, is eliminated. So, you know, basically they don't just grind up the grains and powderize it and sell it. What they do is they grind up the grains, then they cook it, and they take the condensation from it. So it's a water, let's see, made from water-soluble extracts of the roots. If you go to their website, dandyblend.com, they explain how it's done. It's kind of a 2-step process. So anyway, you can get this in the IC Network shop if you like it. Melissa says, is it normal with IC or OAB to have bleeding? No. Only if you have Hunner's lesions. If you have Hunner's lesions are known for kind of weeping, and they can bleed profusely. They call it a waterfall effect after hydrodistension. But normally, if you see any blood in your toilet, or if you're passing bright red blood clots, or your urine is consistently pink or red, that is what I would consider a medical emergency, and I would be connecting with your doctor quickly if you see visible blood or blood clots. You got to figure that out. Melissa says, I'm now finding out my spine is going left, which my doctor said it could be contributing. I'm just so tired. So, Melissa, you're going to like an article that I have in our new magazine that talks specifically about that. It talks about scoliosis, pelvic pain, scoliosis, pelvic pain. And so if you have a spine that's going one direction, not the other, I go all into the anatomy of that and why that happens and why that triggers imbalance in the pelvis and muscle dysfunction, et cetera, et cetera. Joan said, I have not had COVID, but I have parosmia, smelling odors that are not there. My neurologist said it is from the vaccine. I don't know anything about that. So for anybody out there, you feel like you've tried everything and nothing has helped you, I really encourage you to please think about calling me. I mean, I answer the phone virtually almost every day, except Mondays are my day off. Just try to call afternoon Pacific time. Tomorrow, actually, I'm filming a TV show. And then, so I won't be answering the phone tomorrow at all. Amanda says, you help me feel like I'm not alone. Thank you for doing these. I watch them and calm myself down. Yes. Yes, yes, yes. Cindy said, tell us about the wand. So if you have pelvic floor tension, you know, it is important that you learn from your physical therapist things that you can do at home that might help. And generally, what they will have you do is buy a wand. And so this wand is called Easy Magic. And the name of the company is Icy Relief. We sell these in the shop. This is exactly the wand I use. Well, this is my demo. This is not the one I use. That's in my bedroom. This is my demo, right? And so you have to learn how to use these. And once you can, I mean, how do I want to say that? How should I say this? You know, when all the pelvic floor stuff came out, like around 2000, when we started getting inklings of pelvic floor issues, and I had my first physical therapist come to our support group, I was like going, great, that's going to be me. But I didn't do the physical therapy. I mean, it still wasn't widely accepted. I waited another 15 years, right? I waited 15 years. And I realized how little I knew about my body and what felt normal and good in my body. So when I was in physical therapy. The physical therapist said, yeah, you really need to listen to when your muscles are getting tight. For me, it's a pulling session or a pulling sensation or a pushing sensation. That's what tells me my muscles are starting to get tight. Or if I try to go pee, I can't start my stream right away. That also is a very clear sign for me that my pelvic floor is tight. So, you know, she's the one who said, you really need to think about getting this. And I was like, okay, I'll bite. So I got it. And I tried using it, and you're like laying on your back on your bed, and you're putting it in there, and you just don't know what the hell you're doing. It's just so weird. It's just so weird to try to understand what normal tissue feels like, and it takes time. So what I knew when I first did this, is that there were portions that hurt and portions that didn't. But I didn't really know how to move this. And she kept saying it's a J shape. She said, Jill, you move it like a J. There's a little arm and there's a big arm. So I'm laying on my back in my bedroom going, I'm sorry, I do not understand the J shape. And I went back to her for my next appointment. I just said, I don't get it. Tell me about the J shape. And she tried, and I didn't get it. But this is the book. This is the book that taught me the J shape. And I'm going to now show you the J shape because the J shape really works. So let's look at the pelvic cavity here, right? And you would be placing your wand through your vagina or through your rectum if you're a gentleman. And it is a J shape. Here's a small J and a small arm of the J, and there's the big arm of the J. So it is actually a J shape. It's like two J's facing each other. So you've got a J on this side, and you follow the arm, and you have a J on this side. So it's hard to demonstrate. I'm looking at myself reversed, right? So it is a J. It's a J this way, and it's a J that way. And so once I started doing that, then the light bulb turned on, and it's like, oh, I get it. I get it now. And I've done it so many times. I absolutely know what's normal and what's not normal. And what's interesting to me now is it's my right side that gets tight. All it takes is about 2 to 3 minutes of just gently working that muscle, that levator muscle, with my wand, and I can completely get out of tension. So it's kind of a learn by experience thing, but you always start first with your physical therapist, because if you just try going at it alone, you're not necessarily going to be doing it the right way, and that's not good. This is internal work, It can hurt. You could hurt yourself if you do it the wrong way. So anyway, Easy Magic by IC Relief you can find in the IC Network store. I prefer the glass over the plastic because the plastic wands end up leaving microplastics in your tissue, where the glass wand, super smooth, super easy to put in, easy to take out, super easy to clean. Also very easy to clean. Donna says, Jill, you're busy today. I can tell I'm your IC sister, so please do your anxiety exercises. Just a gentle reminder, my love. I'm here for you just like you were here for us. I love you. You know, Donna, I feel pretty good today. To be quite honest, I don't feel anxious at all. I really don't. I feel pretty good. That's good, right? Yeah, that's good. We won't think about it too much. I'm sure I can figure out something that would scare me if I start thinking about it. So I'm just not going to do that. Let's just keep going with your questions. Denise says, I love to cook and bake for my family. They say it's good, but I wouldn't know. It's starting to get to me. Oh, yeah, I know, hun. This virus is a beast. You are the perfect case for why COVID is not just the flu, because there's no flus that turn off your sense of smell. You know, smell is a brain function. And COVID is very good at passing the blood-brain barrier. It attacks the nervous system. But I'm not, you know, I swear I went through some of the early research and that they found that the sense of smell does return. So I really pray and hope that it does for you, that sense of smell and taste. And again, they were talking about you kind of have to reteach the brain. So Google it. And if I find it, if you email me, my email is icnetwork@mac.com. I can try to look for that. I know it's in my email somewhere. I know literally I was just reading about it in the last week. Lisa is saying, I'm thinking a lot of my pain is from pudendal neuralgia. No pain at night, only when I fill up with urine. I'm up through the night, usually every 2 hours. After getting out of bed in the morning, the pain starts. It feels like a pin sticking me. You can't bend forward, much less bend over. Then the spasms start. It lasts until the afternoon, then finally eases, and it's frequency urgency. This has been my life for the last 2 years. It's like a Groundhog Day movie. All urinating is so strained at first. So, yeah. So, honey, Lisa, what did they find in your pelvic floor examination? What'd they find? Shirley, thank you so much for the 50 stars. That's very sweet. Thank you, hon. Thank you very much. Cindy said, do you also get pain on the right side of your back from my pelvic floor? No. I've really never had referred back pain from my pelvic floor, but I have had left side psoas muscle pain from twisting if I have pelvic floor tension. So the psoas muscle is a big, thick muscle that goes up both sides of the spine. I mean, it's like this big in diameter. Think, what's a cut of meat that's like that? I forget. Anyway, big, giant muscle, big, round, thick, meaty muscle. I will get left side psoas spasms from twisting. If I twist the wrong way, that will happen. That's from my scoliosis. I'm supposed to be about an inch taller. You know, I've got an S curve in my back. I'm lucky it's very balanced. You know, you can't see it. The only way you can see it is if I bend over. Cindy said, does a muscle relaxer help your pelvic pain? It helps me. If my pelvic pain's coming from my tight pelvic floor muscles, absolutely. Lisa said, she said there was tightness on the right side. My wand just arrived and I'm trying to figure out the J. So here, let me see if I can draw it. Let me try to draw it for you. 22nd and the 2nd. I hate it when I write down that I have an appointment, but I don't write down what it's for. I think that's for my mom's blood test. Okay, so let me... Oh, okay, no, that's not good. It looks like a butt. Here, let me just go to the expert here, because this is the book, and he has so many good diagrams in this book. Let me see if I can find a diagram that would work for that. The one thing about this book is that they did not do an index, because he is in his 80s, and he just had to get the book out. It took him 15 years to write the book, and he just wanted to get it done. Is this it? Oh, do I show this intimate picture online? It's a pretty intimate picture. I don't think I can really show this picture. Okay, think about it this way. If you're laying on your back, so if you're laying on your back, let's do it this way, right? So here we are, we're laying on our back. So there are two J's. So imagine the short end of the J's rubbing up against each other. And so it goes up this way, and it goes up this way. So, and actually it just kind of goes like this. It's like kind of, just try to visualize it. Each side of your hip is its own independent side. So, okay, like this. So tailbone, rectum, there's your J on that side, there's your J on that side. So if we go back to this, here's your J on this side, and there's your J on that side. And you're going to notice too that as you do this, you're going to be able to move backwards a bit and get to the deeper muscles. And that's how I tend to know if my muscles are really tight, is that the muscles tend to lift off and get hard. And so I just very gently follow the muscle group. And again, it only takes a minute, like 2 or 3 minutes, and the muscles drop right back down. Talk to your physical therapist, okay? Listen, they're the professional. All I can do is try to give you context here. But this is not medical advice. I'm just trying to educate you, but you got to go back to your care provider and ask them too. Lisa says the wand does relax me. Everyone should own one. How do I feel about the eye stem? I'm not in great favor of doing surgical, the implantation of electrodes surgically, aka interstem. It's just so many devastating, hundreds of side effects reported to the FDA. I just can't go there right now. We have a non-invasive neuromodulation at the ankle called Urgent PC. I would suggest that first. It's cheaper. It doesn't require surgery. They're both Medicare approved, and they have fairly equal results. So why go for a major surgery at your spinal cord and at your sacrum when you can reach that same nerve at the ankle? It's called Urgent PC. I can show you my my tattoos. This is what I did. Mm. Can you see that little black spot right there? That little black spot is where they inserted an acupuncture needle as a vector to the nerve. So they inserted an acupuncture needle right there, pain-free, wasn't terrible at all. Attach the TENS unit on, turn the TENS unit on. If the big toe bends down or the little toes flex out, you know you've hit the nerve correctly. What's that about? What did I miss? Something about swimming water? Hold on. I don't know. Swimming, swimming is a great sport, especially for your pelvic floor, especially if you have scoliosis. The challenge are the chemicals. The chemicals can be irritating. So that sucks. All right, guys. Well, we've been doing this for about 2 hours now. So let's go ahead. I got stuff I got to do. I have got to finish my COVID cystitis website. I want to get that up. I got too many patients calling and they need help. So I want to work on that today. So I think I'm going to do a last call for questions. Last call for questions. Come on over to the IC Network website, sign up for our free newsletter. You'll see a couple of new blogs. I'll be sending out a newsletter hopefully this week. And then we'll have our new magazine out hopefully by the end of the week, at least the e-version. More coming. Getting ready to start filming some TikToks. I'm ready to do TikTok. Got some other projects going on. Be doing a chemocystitis website for patients who have bladder issues from chemotherapy. That's in the works. Going to be redoing our flare guide, redoing our diet guide. Well, you guys, thank you so much for your good news. Now, listen, I got to be really honest with you. I got to be really honest with you. Like, seriously, Facebook, it's hard for me. It's hard for me. Doing these meetings is fine. I love doing this. But coming in and reading the IC groups breaks my heart and makes me furious. And some of the information shared is just shocking to me. And if Facebook, listen, you're all different. The problem with some of these online support groups is they don't tell you that. And you read somebody's horror story, God forbid you be newly diagnosed, and you're going, oh my God, that's my life. I'm going to have to look forward to that and scare the hell out of you. No. The ultimate flaw with Facebook is we just have group leaders who aren't trained, or they have their own belief combined with lots of different groups, lots of different people in groups. And so I hope that you will not rely on some of these groups for all of your information. You got to credibility check it. You got to read. You got to start learning for yourself. Like there was one person who walked into a group and said, should I have my bladder removed? And somebody said, yes. It's like, what? No, absolutely not. No, there's a whole bunch of stuff that can happen before then. And now we know about subtypes. For God forbid you have your bladder removed and your IC subtype 3 pelvic floor driven, and the bladder removal will be for naught. Do not ask complete strangers for medical advice. Please do not do that. And so If you have a history of trauma, pelvic floor tension, your muscles continue to stay tight, this is the book. This is the best book ever written. This is a game-changing book, and it's free on Kindle Unlimited. For God's sake, it's free. No excuses. You've got to learn your body. And if you have any history of trauma, broken tailbones, anything at all like that, you have to read this book. If you're a bike rider, you have to read this book. If you have one leg longer than the other, if you have bad feet, bad knees, bad hips, bad SI joints, this is the book. It is filled with success stories. Look, I'm going to open it just one page. Let me, I just want to read. Let me just read you a couple of success stories before I go here. So here, hold on a sec. This is just such a brilliant book. All right. Teresa's story. Teresa was 32 years old with a 5-year history of painful intercourse. 2 years prior to the onset of vulvar pain, she began to suffer from bladder infections from intercourse. When the antibiotics prescribed for this problem not only failed to solve it, but also caused yeast infections, she was further distressed. Hoping to find a specialist who could pull her out of her misery, she consulted a urologist who recommended examining the bladder and the urethra. Unfortunately, Teresa's urethral sphincter muscle was so tight from all of her infections that the cystoscope could not even be inserted without force. This result was very traumatic and painful. Let's see, the result of this very traumatic and painful procedure was an escalation of her vaginal pain that became so severe she was no longer able to have sex. This prompted her physicians to try a wide variety of treatments that included oral amitriptyline, Neurontin, a topical mixture of lidocaine and amitriptyline, estrase cream, allergy drops, external pelvic physical therapy. When none of these provided any relief, she consulted me. My examination produced a host of significant findings, including textbook examples of pelvic floor trigger points and areas of subcutaneous tissue sensitivity that are typically associated with vulvar pain. There was also marked sensitivity of the tissues around the vaginal opening when I touched them with a cotton swab, and the pudendal nerves that supply the vulvar tissues were very tender to touch. Teresa's bladder infections had started the pain ball rolling by causing the pelvic floor muscles, which include the pubovaginous muscles around the vagina, to tighten in response to recurrent inflammation. The vaginal yeast infections resulted in further muscle spasm that culminated in the development of asymptomatic trigger points. The tight dysfunctional muscles were now an accident waiting to happen. The final blow was a very traumatic cystoscopy that sent them into intense spasm, prevented sex, activated pelvic floor trigger points, and compressed the pudendal nerve. And furthermore, 5 years of constant painful stimuli had sensitized her central nervous system. Our treatment regimen addressed every level of Teresa's problem, beginning with the tissue sensitivity and irritation. She continued Neurontin to calm the distressed nervous system and a lidoderm anesthetic patch. Hold on. Whoa, this was a good one. Holy crap. What a good one to do. Okay. And a lidoderm anesthetic patch was used nightly at the vaginal opening to desensitize the nerve endings there. The vulvar tissues were protected from irritating secretions with regular applications of coconut oil, and a symptomatic relief from itching was achieved with topical applications of doxepin hydrochloride, which is a topical antidepressant that works on nerve endings. Concurrently, at the same time, I administered internal myofascial release to eradicate trigger points, lengthen contracted muscles, and mobilize the sensitized pudendal nerve. Subcutaneous tissue manipulation was also performed to reverse restrictions and tenderness in the areas of the buttocks, pubics, and inner thighs. After 8 months of treatment, Teresa was finally able to have sex without pain. However, there were occasional flares of low-grade intensity attributed to the reactivation of trigger points in the pubovaginalis muscles around the vaginal opening and the piriformis muscles that rotate the hips. These were successfully treated with dry needling technique. As with most vulvodynia patients, Teresa's symptoms occasionally reappear, usually due to emotional stress or activities that strain the pelvic floor muscles. The cornerstone of treatment for pelvic floor muscle dysfunction are internal and external myofascial release to manually relax tight, tender muscles and eliminate trigger points. Donna says, I need to get this book. I fell down 15 icy steps and bent your tailbone. Absolutely. Dr. Jerome Weiss, this is a love letter to IC patients. He is 85 years old now and retired. He wrote this to give you a lifeline, to give you things that you can pursue, especially if you have a history of pelvic trauma like Donna, you. If you can go back and your symptoms began after injury trauma, this is the book for you. And there's no bladder therapy that's going to fix this. And that case study proved that. Jerry says, I've been having a bladder installation over a year, once a month. Is this bad? No. Well, the far more important question is it helping you? Does it help? And what are they doing? Right? Okay, so Breaking Through Chronic Pelvic Pain, fantastic book. And it's free on Kindle Unlimited. No excuses. It's free. This will change your life. I have read this book twice. Every time I read it, I highlight new areas. This has taught me so much about pelvic pain. You got to study it. And then the second book that I would recommend, oh my God, I have a book reveal to do too, is Facing Pelvic Pain. If your muscles are healthy and bladder therapies aren't working, then what the hell else is happening? This is the book that will walk you through that. You know, there are lots of different structures and influences to the bladder. This book, super easy to read, Facing Pelvic Pain. I think it's also free on Kindle Unlimited. You can get it on Amazon. Fabulous, fabulous book, produced by Harvard. I'm a co-author of this book also. Okay, great book. And then, oh, here's our freebie. For those of you who stuck it out, y'all stuck it out, the 30 people who are here right now. Look at what we just got. The brand new book on diet. Look at this. Delicious with IC, Interstitial Cystitis. This book is produced by the Israeli IC Association, the Israeli Association for Bladder Syndromes. It is wonderful. Great new recipes, beautifully laid out, best laid out IC book probably ever, right? Lots and lots of interesting, fun recipes here. And so I tell you what, if let me give 2 of these books away. I'll give two of these books away right now as a gift from us. Okay, and you get to share with other people. So if you are interested in getting this book, I need you to email me icnetwork@mac.com. icnetwork@mac.com. And I need your mailing address, not your email address, your mailing address. If you are interested in getting a free copy of Delicious with IC, I will give 2 of these away, and the rest are going to be over in our store. All right? You got to email me, icnetwork@mac.com. Mac as short for Macintosh computer. M as in Mary, A as in Apple, C as in Charlie, mac.com. All right, guys. I will see you later. Y'all have a wonderful holiday tomorrow. Monday is a holiday. I will be back on Facebook and do a Facebook-only live support group meeting either on Thursday or Friday. I think I'm going to try out Instagram. I'll do an Instagram live support. So go on over to our Instagram page and sign up over there if you're interested in that. And let's just keep on keeping on, one day at a time. You can do it. I believe in you. The most important thing I want you to remember from this conversation is this is not your fault. You have done nothing wrong. No shame, no blame. It's not what's wrong with you. It's what happened to you. You were hurt. You were hurt in some way, whether it was a physical injury to your pelvis or an injury to your bladder or an injury to your central nervous system. It's not your fault. Carry hope in your heart. I wish you well. For everybody who's having a bad day, big giant hug for me. If you're going to the doctor this week, I want you to pretend that I'm walking right next to you. And I'm telling you, do it. Come on, you can ask that question. Go for it. Be strong, and mighty forces shall come to thy aid. Be bold, and mighty forces shall come to thy aid. Becky says, will you make a post on Facebook to tell us when you're going to go live on it? I will try. I will try. Okay? All right, guys. I'll see you later. Have a good one. All right. So I'm going to say goodbye to Facebook first. All right. Facebook is turned off. All right, YouTube, you guys, y'all be well. Y'all have a good, very, 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 very good week. See you later, Donna. Nice to see you.